Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, Dr. DrAndyRoark. I am here today with a legend, Dr. Derek Fox. He's talking about his passion, which is angular limb deformities. And I know people are like, Andy, I'm not sawing bone. It's like, trust me, this stuff is fascinating. And we talk a lot about what is a general practitioner going to be doing with this? What do I need to do to set expectations for pet owners? How do I need to be monitoring and following up on cases that I think might need corrective surgery or that have gotten corrective surgery? Anyway, we get into all of that stuff. It's just absolutely jam-packed with pearls. This is a really interesting episode, and it's on a subject that most of us don't hear a lot about, but we see these dogs with feet on sideways coming in the door. I want to make sure I'm doing what I can to take care of these pets when I see them. So anyway, that's what we're doing today. It's really good. Let's get into this episode.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. DrAndyRoark.
Welcome to the podcast, Dr. Derek Fox. How are you?
I'm very well. Thank you so much for having me. It's a real honor.
Oh, man. It's so funny to hear you say that. I'm like, you, sir, are above this podcast. I have to say, I appreciate you making time for it.
Absolutely.
For those who don't know you are professor of small animal orthopedic surgery and chief of the small animal surgery service at the University of Missouri's Veterinary Health Center. You are one of the absolute leaders in angular limb deformity and malalignment and an orthopedic surgeon by training. I am thrilled to have you on today because I want to talk to you about sort of your passion, as I have heard it, in limb malalignment. And so when we first started to talk about limb malalignment, you said to me that we don't tend to think about things like patellar luxation in terms of being a malalignment, or potentially hip dysplasia or some types of hip dysplasia as malalignment issues. And I think that's very true. And so when I think about limb deformities or malalignment, I think about the Basset hounds that have their feet turned around and twisted out to the side. And so let me just start at the top here and say, high level overview. Talk to me a little bit about limb malalignment and what it looks like in clinical practice.
That's a great question. And when I started, when I was doing my residency, many years ago, that's what we thought of when you would hear the term angular limb deformity, you thought of the Basset hound that has his feet on quote unquote sideways. And I literally have had patients referred to me where the referring veterinarian will call and they'll say, Doc, I'm not lying to you. This dog's got his feet on backwards. And,
wow.
And the dog will show up, and certainly, it's pretty malaligned. But as I have studied this topic over the years, what I have learned is there are so many different orthopedic conditions that at their roots can also be attributed to diseases of malalignment of the limb. And as you just mentioned, patellar luxation is a great example. And, when I was a young resident in 99 and 2000, we thought the patella was the problem. Just by the name, it's a patellar luxation. The patella must be the problem. And what we've learned now over the past 20 years is the patella is never the problem. The problem is the femur is malaligned, or the tibia may be malaligned. And most of our correction strategies are aimed at realigning the femur and the tibia. Another great example that has been investigated now in great depth is elbow dysplasia, and a very specific kind of elbow dysplasia, which is cornoid disease. And there's a subcategory of that can be called medial compartment syndrome, where the dogs will develop severe osteoarthritis in the medial compartment of their elbow, where we're relying the medial cornoid.
Yeah.
And there are many investigators now who think that this may be as a result of malalignment of the humerus to the radius and the ulna, which can put excessive force and pressure on that. So the topic of limb alignment really goes beyond the classic deformity, of the Basset, and it really does apply now to all of orthopedics. And we are now looking at old conditions through new eyes and studying their limb alignment to find out if that is at the root source of that secondary disease entity.
Okay, help me to be a better doctor. What should be causing me to start thinking about limb alignment abnormalities that I'm not thinking about it now? Like, what is walking through my door that I'm looking at, that I'm laying hands on, and limb alignment abnormality is not popping into my mind? Help me to spot this earlier.
I think it probably is beneficial to kind of maybe lump them into different categories, right?
Okay.
Because let's just take the Basset, right? You got a dog that's coming, maybe it's a year-old Basset. They seem to be the classic, and they're just starting to develop a lameness. And sure enough, there's asymmetry between the left and the right forelimb, and that right forelimb is really, really, really angulated. That's a classic, pretty quick observation that, wow, I think this dog's got, severe limb malalignment of its forelimb. This is attributable probably to growth disturbance at the level of his growth plates, and there are a lot of reasons why Bassets get these specifically. And that's one kind of category. But I think just as we've spoken about, there are other categories of diseases that we didn't used to classically think of as malalignment. Again, think about the patellar luxation. Say you've got, a 1.5-year-old Yorkshire Terrier, and he is, walking extremely bow-legged in the rear limbs. And he's struggling. He's struggling to, jump up on things. He's struggling to have any jumping ability. And you palpate that and you're like, wow, these patellas are out and I'm unable to put them back in. So that's what we call a grade 4 patellar luxation. And I can guarantee you, grade 3 and 4 patellar luxations, those dogs have some kind of malalignment of their femur and their tibia. And so that's not probably, especially if you're in general practice and you feel pretty comfortable correcting patellar luxations, as many general practitioners are, and they do a great job. A grade 4 patellar luxation is not the same as a grade 2 patellar luxation, meaning that it's going to require something above and beyond maybe more simple or straightforward surgical corrections that we've all learned in vet school, like a wedge recession or a tibial tuberosity transposition. A grade 4 patellar luxation is probably going to need some kind of realignment of its femur or tibia that it goes above and beyond. And if we don't address that malalignment, the recurrence of that patellar luxation, that risk gets much, much higher.
When we start talking about these types of conditions, I got to be honest with you, Derek, like intervention seems, it's scary to me. You know what I mean? Like this is even a soft tissue surgery. I go, okay, I can get my hands in there. I can do that. We're really talking about orthopedic intervention in a significant way, especially if we're talking about a young dog. And so I'm talking to the pet owner and going, well, this is kind of what we're looking at. And I'm worried that we're progressing in this direction.
Right.
And the intervention is for me to cut the bone and reposition it and put it back. How do you start to look at these cases? And so I'm gonna go all the way around to kind of how do we sort of balance these things out. But one, in your mind, do you feel like intervention is a pretty significant step? And then how do you start to think about I don't want to say, how do you start to think about categorizing these patients as, this is a dog that I would strongly recommend intervention. Yeah. This is a dog where we might see an issue, but I don't know. Help me to balance those things.
Yeah, that's a really good question. And obviously so many of the issues or the conditions that involve malalignment, they're starting as juveniles, right? Because the puppies are, there's some maybe growth disturbance of the physes, and so the limb is starting to become malaligned, and it's getting more severe as the animal matures. And this is it's a really great question, because this is one of the trickiest aspects of dealing with any of these is like, okay, when do I intervene? How do I intervene? And it really is so dependent on the condition that the animal is presenting with and its severity, okay, and how much and what is the age of the patient. Many dogs that present with a malalignment, say at 8 or 9 months of age, we may just say, hey, let's wait and watch, okay? Because most of the dog's longitudinal bone growth is going to be done by 10 or 10 and a half months of age. So we're just going to tap the brakes and we're going to reassess, and in some dogs that present, very young, 4 or 5 months, and I can think of a classic example are some Great Danes that, will present to me with their forelimbs and they're starting to develop some distal radial valgus. And the owner's very concerned. The referring veterinarian may be very concerned because it definitely seems to be beyond what we would consider just normal variant and alignment. There are different strategies. One might say, hey, let's intervene right now. Let's do something right now. But I've seen many of those dogs outgrow it. And so it really is on a case-by-case basis. It depends kind of on which bone is affected, what is the age of the dog, and what is the severity. Because A Great Dane that is very symmetrical and both of its forelimbs are starting to develop a little bit of valgus at say 4.5, 5 months of age, I'm probably going to sit and watch and wait and recheck them monthly. If it's say let's say it's a 5-month-old border collie who's very straight in the left forelimb, but now is really valgus on the right side, I'm probably going to pursue something like we probably have premature closure of one of the distal physes of the radius of the ulna. Let's get RADs. And if it's drifting that bad at this young of age, I'm probably going to intervene to some degree. Yeah.
Well, are you gonna sort of wait for growth plates and stuff to close before you start to intervene? So I always feel like when I see this 4-month-old dog, and I'm seeing this abnormality, I don't know if I pick this up, I don't know if I just imagine this, but I immediately feel this ticking clock of we need to intervene on this as early as this development is happening. What I'm hearing from you is it doesn't sound like racing to do something is as valuable maybe as I thought it was.
Well, we all have that urge, right? And it's especially bad in surgeons, too much so, is that we think that, oh, I'm going to be this animal's best friend because I'm going to get in there and cut it and intervene. And, one of the things I've learned over the many years of doing this is sometimes it is best to wait and watch. And so when would that situation arise for me? It would really depend, again, on the severity of it. In some dogs, you just see at 4 or 5 months of age, and they've got, let's stay on the topic of the anabrachium, they've got so much carpal valgus that it's like, okay, there's no way this is going to autocorrect. I think we might need to intervene. And one of the things that we'll do is obviously just, simply take radiographs and look, and radiographically, do I still see a physis that has got some degree of opening to it, or is it, already shut down? Do I see no, radiolucency in that physis, meaning that physis is shut down and there's no opportunity to pull this out of the nosedive, in which case I'm going to intervene. But like that Great Dane example I gave you, it's a dog, Great Dane, comes in about that age. He's bilaterally kind of symmetrical. He's just going a little bit valgus. If I take radiographs and his physes are still wide open, I might tap the brakes and give that dog an opportunity to see if he can't correct on his own.
When you talk about seeing these dogs come in and you say, I might wait and I'll just sort of recheck them. How are you rechecking this? Are you monitoring degrees rotation? What does that look like when you say, I'm going to see this dog back? I want to see if it's getting worse. How do you know?
Great question. So how does one, wait and watch on any kind of, developing angular deformity? There are several ways to do this. The first, most basic, is just through gross examination. Okay. And it can be as simple as taking a goniometer and just laying it on. Let's say we're dealing with anabrachium. Okay. How much are the metacarpals valgus with respect to the anabrachium? We can measure that grossly, and inexpensively with a goniometer. Just laying a goniometer down, one arm of the goniometer down the radius and the ulna, the other down the metacarpals, measuring that angle, recording it in the medical record, checking that monthly. And if we really want to see, radiographically how the physes are looking, are they staying open or are they shutting down? Just taking radiographs. And for some of these guys, I'll radiograph them monthly. Yeah.
When you're looking at these dogs and you're kind of deciding what you're going to do and sort of how you're going to intervene, how has your approach evolved over the last 10 or 15 years? What are you looking at differently? How are you approaching these differently than you did kind of earlier in your career when you were less experienced or when we knew sort of less about the conditions?
Yeah. Well, I was definitely more aggressive surgically as a younger surgeon because that's how I was trained and taught. So if you saw a dog that had developing radial valgus, the kind of the classic premature closure of the distal ulnar physis that all your listeners will, be, well educated in. Man, I would fire in and do an ulnar ostectomy to try to release that tension on the ulna, the bowstring effect, and that radius will now autocorrect. And so we did a lot of those. What I've learned over the years is, those ulnar ostectomies, they're not quite as effective as we once thought they were. We see relatively few. It may prevent it from getting worse, but relatively few radius then go ahead and autocorrect. there's definitely a need for that in improving elbow congruity. So that's a whole other topic. But over the years, I've become a little bit more conservative and less aggressive surgically early on.
Yeah.
But I've also just become, I think, better at making that call of, wow, this is so severe at such a young age. If we don't intervene, we're going to lose the carpus, or the elbow will get dramatically worse. And then instead of just trying to accomplish anything through an ulnar ostectomy, I'll go in and do a correction. And so a puppy has come in with a severely angulated forelimb that is developing. And it's quite asymmetric, and I'll radiograph it, and the physes are shutting down already by 5 months of age. Okay, an ulnar ostectomy is not going to cut it. So it's kind of the go big or go home. If you're going to go in and do something, let's get it right. And so for an animal like that, what we would do is put on a hinged external fixator or an Ilizarov frame, and then gradually pull it back around. And retrain that forelimb.
When you look at these and you think, oh man, we're going to have to do something. That's going to be unacceptable. Does that just come with experience, or are there certain flags that you see waving where you go, when I see these things, that's when I really get motivated immediately?
And there are certain flags. Some of it is subjective, to be sure. Some of it is experience, because I've been doing this for so long. But there are other things. If I see radiographically, and I would always radiograph a dog, if they've got left to right asymmetry, meaning, one of these is really starting to drift, that's the first marker. This isn't just the dog's conformation. It's not just a Great Dane that, may be a little turned out in the feet. So if I see asymmetry, that to me automatically is a warning bell, like, okay, the physes on the right side or the left side, something has happened there. Let's get radiographs. Another big flag for me is if I'm losing elbow congruity. If the ulna is not matching up with the radius in the elbow, we need to intervene and do something. We need to try to save that elbow by optimizing the congruity. That is a red flag for, surgically we need to do something. And then the severity of the lameness and the angulation. And this is where it gets a little subjective, but if owners are telling me, he's consistently lame on this, he's only a 5-6 month old dog, but he's really lame. And if that asymmetry, is pretty pronounced, if you walk in the room and say, wow, I can just across the room, I can see a difference between the left and the right, that's going to be something, and he's concurrently lame, that's probably going to prompt me to want to do something. Gotcha. And the last red flag I can think of is if I take an x-ray in that patient and the physis is shut down, either the distal ulna or part of the distal radial physis, growth potential, there's no growth that's going to overcome that. It's spot welded itself down. We probably need to intervene.
Yeah, that makes sense. If you could huddle together the general practitioners of the world and say, all right, guys, when you see these coming in, this is what I think, this is the small thing, the first step that I would love to see GPs doing more of in general practice, right? I'm not asking you to become an orthopedic surgeon, but when you see this is something that I think would benefit the patients. I think it would benefit, the orthopedists you refer to. What is this, like the fairly subtle ask of, hey, just maybe make sure you do this?
Excellent question. So the first thing, and some of these things are so, easily done, is photograph the animal, from straight, and again, it's different for different limbs and different conditions, right? But let's stick with the forelimb, and you've got a puppy that you think has got a developing angulation, malalignment of its forelimb, the classic, right?
Yeah.
Photograph it. Have, the dog sit there and get a, straight cranial to caudal or front to back, just photograph and get both forelimbs in that photograph at the same time. It's a great thing to put into your medical record so that you can visually watch this animal over time. It's objective.
Yeah.
Okay. And it's a snapshot in time. You can do that again in 3 weeks or 4 weeks. Puppies change so quickly. So just getting a photograph is fantastic. And then the next thing I would say is then orthogonal radiographs of the anabrachium, including both the carpus and the elbow, because it's not just the malalignment of the radius that we're worried about. We're really worried about what is happening in the joints, right? What is happening in that carpus? And then maybe more importantly, what is helping in that, or what is going on in that elbow? Does he have incongruity along with this deformity, or is the elbow really, look great? Because that is a major deciding factor if I'm going to intervene very young, or if I'm going to just tap the brakes and wait and see how he develops. Yeah. Because if we got a lot of elbow incongruity at 5 months, we need to get in there and do something. If the elbow is fine, but he's starting to develop a little valgus, probably safe to wait and watch that month by month, and maybe pull the trigger later on. But so again, taking a photograph of that animal so that we can get in a really nice visual between the left and the right, that's something you could put in your own medical record. And then orthogonal radiographs, including both the carpus and the elbow.
Yeah, that sounds fantastic. This is easy to do. It totally makes sense. Yeah, I like that a lot. What expectations should I be setting in pet owners' minds when they come in and they've got let's say they've got the 6 to 8, 10-month-old, young dog, and I'm seeing pretty significant limb abnormality, and there's some, it's affecting the gait, and I say, look, I think we're gonna have to do something about this, and they're going to say to me, what does that mean, Dr. Roark? What are the healthy expectations to put into their mind about one is just outcome long-term? What is the prognosis if they take action? And then just general recovery time. And I don't know, I don't want to say cost necessarily, but an idea of like, what are they getting into and how do I communicate that to them?
Yeah, these are all, just the perfect questions, and the questions that I answer day in and day out for my own clientele. Sure. And, what they're getting, it was one of the first most basic questions that I get from, any client is, hey, is there a brace? Is there something I can do? Is there a medicine that I can do to, revive these growth plates and correct this? And unfortunately, there's not. Yeah. The only thing that we can really do is some kind of surgical intervention. And with that surgical intervention, that is, it's pretty invasive, unfortunately, for most of these cases. Straightening a malaligned bone means corrective osteotomies. And it can be more than one corrective osteotomy, especially when you look at the chondrodystrophic breeds. To address an earlier question, they get a very specific kind of deformity in which they actually have multiple deformities, not just a single deformity. So these can be quite invasive procedures that, require an invasive, operation to get in there and make corrective osteotomies. And either through external fixation or internal fixation with a bone plate and screws, we're going to be straightening the bone, realigning the joints. Then the next thing that they're going to have to expect is the aftercare can be sometimes quite challenging. Yeah. So they're looking at, in a young dog, 2 to 3 months post-op, no running, no jumping, no playing, no stairs. The dog may be in a splint for 6 to 8 weeks afterwards, depending if we do internal fixation. Lots of rechecks, at the vet to have those bandages changed. And in long term, we've yet to do really good long-term evaluation, objective outcome measures to learn how much return of function they get. We know we improve them significantly, but I am very comfortable saying none of these dogs we get back to 100% normal. Yeah. Okay. There's always a ramification of having a malaligned limb as a young animal. And usually that comes from loss of range of motion in the carpus and or some osteoarthritis in the carpus or the elbow. And that is frequently what the rate limiting stuff is. That
totally makes sense. I was going to ask you about that, to sort of say, if the owner says to me, okay, well, he might not run the same, but he's going to be comfortable, right? You kind of have to prep them and say, there could be osteoarthritis here. It might not be completely pain-free, but we're going to do our best. Okay.
Yeah, and in nearly all the cases that I deal with that have severe distal radial ulnar malalignment from a premature closure of the distal ulnar physis, they lose a lot of range of motion in their carpus. Really? And we don't yet know what the full ramifications are of that long-term, like, hey, how much is this really, limiting them? But to preserve pet level function and comfort, it is quite amazing. I have clients who's 13 years post-op will send me video of their dog, and the dogs are running and having a great time. Yeah. And, we know that this is, one of the orthopedic procedures we do where we can dramatically improve the quality of life of an animal just through, limb alignment, reestablishing that.
If you've got somebody who's fascinated by this and they go, I think these cases are so interesting. I've always thought angular limb abnormalities were just really, really interesting. Do you have a favorite resource for people to go to? So short of going to a residency, what do you like for people who really geek out about this?
Yeah, great question. So Obviously, we've written a lot of papers on this topic over the years, and anyone, if they really want to nerd out on this, can hit PubMed and you could search my name, and you're going to find a lot of papers. We've written several textbook chapters about this. We're kind of in the planning phase of writing an entire dedicated textbook on this topic. It's a massive undertaking.
Yeah.
But we also teach courses in limb alignment correction. And I'm teaching, I think, 3 courses this year through AO, also through ACVS. The ACVS course will be in June in Fort Collins. We're teaching an AO course on this topic in Glendale, Arizona in October. I'm also going to Italy to teach this internationally in March. And these courses are dedicated to the forelimb or to the rear limb. So if you have more of the cases that you're saying them are pelvic limb, we've got a pelvic limb 3-day course in that. So there are lots of opportunities to learn more about this for sure.
That's fantastic. I'll put some links in the show notes for people who are interested in learning more. Dr. Derek Fox, thank you so much for being here. I really appreciate your time. Thanks for sharing. Guys, thanks for tuning in and listening, everybody. Take care of yourselves. And that's what I got. Guys, thanks for being here. Thanks to Dr. Derek Fox for being here and sharing his years of knowledge and experience. Gang, I hope you took something away from this. I know I did. It's just stuff like this just makes me want to do better. I'm going to be taking pictures of my patients when I start to say, hey, we need to document this foot is starting to turn out in a way I don't like, and I'm hoping it's going to come back. But let's go ahead and get some good photos of this. And I've had a couple episodes recently. I talked to Dr. Fox. I talked to Dr. Donnell Hansen, the dentist, recently, and they're both just like, hey, take photos of what you're seeing. And I just go, man, I think a lot of us really need to step their game up. I need to step my game up with photos and putting them into the records. I take photos of my patients and keep them on my cell phone, which is not the medical standard that it should be. And so anyway, just great advice. It's practical stuff that I'm pledging here right now to do better and to start capturing that stuff and really putting in the records and being intentional about it. So I am making that pledge to you guys right now today. Anyway, gang, take care of yourselves. Be well. I'll talk to you later on.